Welcome to the National Women's Fitness Academy podcast. We're here to talk about women's health, female hormones, body image, and all things health and fitness.
Hello, girls, and welcome to another episode. I'm your host, Sigi, and today's episode is one to bookmark and to save for replay because we'll be diving deep into women's hormones with today's special guest. Now, as you can hear by the sound of my voice, I'm very excited for this one because today I've got the absolute pleasure. I can't even place my words together. I have the absolute pleasure of speaking with Dr. Carrie Jones, who is a hormones expert. She's also a functional medicine, women's health and hormone doctor who truly believes in the importance of us as women understanding our hormones in a very simple manner so we can feel very empowered and taking control of our bodies, controlling of our health. And whenever we've been told that everything is normal, when we know it's quite not that normal. Carrie has been in this field of functional and integrative medicine for over 15 years right now. Correct me if I'm wrong, but she is also a naturopathic physician and is also a medical director for Precision Analytical, including who are the creators of the most cutting-edge hormone test on the market, which is called the Dutch test. If you're unsure of the Dutch test, that's fine. We're going to dive a little bit deep into that today as well. But before I let Carrie talk, I just want to say that one of my favorite things about you is your sense of humor, your real talk education, and your analogies. I don't know how you come up with these analogies, but I tell you what, they are phenomenal. So, Carrie, welcome. Thank you for being here with me.
Oh my goodness. Well, thank you so much for having me on. I can't wait. This is going to be fun.
It's going to be so much fun. So much fun. So, as I mentioned before, I want us to dive a little bit deeper into how, well, I can speak from experience. I remember there were many times that I would go to a specialist or go to a doctor and do certain tests. And they would just come back with my results saying, oh, you're normal. It's fine. Like nothing's wrong. It's all in your head. But you know, it's not all in your head. You know, something's not quite normal. So my question to you is, how often do you come across this matter?
Yes, all the time. I find, I think as women, we are taught, or we just do handle a lot. Right? Like we get the periods, like we're responsible for growing the babies if we plan to do that. And we have to go through perimenopause and menopause. And so with all this change and transition and our cycle, generationally, a lot of women are just taught like, that's normal. That's to be expected. Suck it up, buttercup. And the truth of the matter is just because it's common doesn't mean it's normal. And I also found, and you may agree with me, like a lot of women, we were not taught about our bodies other than like how to avoid, like the P goes in the V and you can make a baby, right? Like that's about the most we were taught in school when we were a lot younger for a lot of us. And so as we get older and start to experience symptoms, we actually don't know where to turn. We don't know the questions to ask. We don't know if it's considered normal or common or both. And that's where I love educators like yourself and me that are out there trying to explain to women, like, it's your body. It's okay to ask questions and it's okay to get to the bottom of some of these things and to find out like, oh, that's expected is part of the cycle. I mean, I would even have women that were like, you know, in the middle of my cycle, sometimes, you know, I get mucus. Is that normal? I'm like, yes, that's ovulation mucus. You're like, they're going, oh my God, every month I get a yeast infection. I'm like, well, actually, no, every month you ovulate and you get this mucus. Is it kind of stretchy and then it goes away? They're like, yeah, that's exactly what it does. I'm like, probably not a yeast infection, but like nobody taught them these things. And so that's sort of one of my missions is, okay, let's just go back to fundamentals. Let's just teach women what's going on with them, with their body so that they can get the help they need.
So true. It's so funny how you mentioned that some women think they have a yeast infection. I swear, I reckon when I was younger, I used to think something was abnormal about me during the ovulation period because I wasn't taught that, you have vaginal mucus coming out of you on a monthly basis. So I literally thought something was wrong with me. I would go to the doctor. They would give me medication without even assessing me to actually notice if something's wrong. And I would just take all this medication because I thought I had something wrong with me.
Yeah.
Where I didn't.
Right. I mean, it's even, I've had women come to me when I was in practice and they would go, I have breast pain. I have breast pain. It must be cancer. My boobs hurt. It must be cancer. And I'm like, do you have it all the time? And they're like, no, it's weird. It's like right before my period. I'm like, not cancer. I'm not saying it's necessarily a good thing, but like, this is what's happening with your breast tissue right before your cycle. And for some women that's very sensitive and it can be painful. And so just cancer is a big deal. And to think to yourself every single month, oh my gosh, that must be growing cancer. That's horrifying. And to the fact that nobody's told any of us, like, hey, look, you could get breast pain and it's caused by these hormone changes, but it can also be caused by chocolate and coffee. Unfortunately, who thought of that? And then, there's things you can do to really help improve your breast pain so you don't panic and think you have breast cancer every month. How great would that have been to get a manual,
I know, right?
Course, like to get a text message, just the daily update of what's happening.
So true. I want to dive a little bit into the coffee and chocolate a little bit. Tell me more about, tell our listeners a little bit more about that.
Yeah, gosh, it's so unfair. So, coffee beans and chocolate can cause irritation to the tissue in your breast. Like estrogen can do it. Too much estrogen, not enough progesterone. Estrogen related chemicals. So think about like your plastics, what are called phthalates, synthetic fragrances, that sort of thing. But sadly, so can chocolate and coffee. And so I have had people say, well, does it matter if it's organic? Does it matter if it's, really healthy chocolate or healthy coffee? And honestly, it depends on the woman because the chemicals in them can make the breast pain worse, but there's a part of the chocolate and part of the coffee itself that does it. And I've had so many women over the years go, right before my period, I have to stop coffee or I have to stop chocolate, which is the one time they want it, right? Like that's when we want it the most. And they notice their breast pain gets significantly better. But it's like everything in the female body, it's like a bucket. So if you are putting drops of water in your bucket and all of a sudden the bucket's like right near the top, it's like just about to like overflow, then chocolate's probably going to push you over the edge. But if your bucket's pretty much empty, you've been working a lot of stuff, you've working with a doctor, your diet, your lifestyle, your habits, the products that you use, you may find you have no issue with chocolate. You may be eating chocolate as you listen to this and think, well, my boobs don't hurt. It's like, it doesn't affect everyone. And it really depends on the water level in your bucket. So if you're listening to this though, when you do have breast pain and you are on your 4th cup of coffee for the day, probably want to cut back on that.
Yeah.
The coffee, the caffeine and the chocolate.
Yeah, been there, done that. I remember years ago, I was obsessed with having coffee and I used to have severe breast pain. And then once I started reducing the coffee and the chocolate intake, you notice a drastic change. So I love that you mentioned that because it does come down to, again, listening to your body, realizing that it's not breast cancer. It's something a little bit, more than that, which is good to know. So back to, obviously us understanding our bodies. We weren't really taught this when we were younger. I feel as if the industry is changing a little bit. I don't know about what it's like in the US, but like over here in Australia, I've noticed a big change in the education around women's hormones and health. Has it changed over there as well?
It depends where you are. Like I said before we went live, we are the United States of America, but we're not very united. So it kind of depends on the state that you're in. However, I will say in the realm of education, women's health and hormones has exploded. The number of books that have come out for consumers to read, the amount of websites, the amount of organizations that have formed. for all ages. I mean, and not even just somebody, like an adult. I mean, there's all sorts of information for girls entering puberty and in high school age, and then moving into university. And I really appreciate that it's not just focused on historically, like, here's how to have a baby, right? Like every book was about how to have a baby. And if you're like, well, I don't want to have a baby, I just have severe cramps and, my hair's falling out. What do I do? And so now that tide is turning and we're seeing a lot more resources that women can turn to. And I think social media has been a massive part of that, is that women, I mean, you should still go to your practitioner, your doctor, but on the other hand, when you go to some of these really great educational sites, like you have a post up recently about what does progesterone do and what does estrogen do? Like so many women don't even know. Well, first of all, so many women don't even know those hormones exist in their body. And then what they do. And just so to read that list and go, oh my gosh, I didn't know progesterone helps the calming hormone GABA. Like, I don't feel very calm. I wonder if I'm missing, this hormone is low in me. And just to put those puzzle pieces together with the resources available, I love, which we didn't used to have. We didn't have when I was a lot younger.
Yeah, so true. I remember like when I was younger as well, I suffered from a lot of histamine response during that time of the month. And I just used to think it was allergies. So I used to take histamine tablets for it to like go. But now diving a little bit deeper into it, even like, I think it was like your recent post on the relationship with histamine and estrogen. Correct me if I'm wrong. I think it was maybe like couple of weeks ago, and you were talking about if you have a high risk of histamine, you must be having estrogen problems.
And so many women commented, because the symptoms, just like you said, so many women were like, I thought it was allergies every month, because they're getting stuffy or sniffy or congested or like rashes, hives, or they'd scratch their skin and like their skin would raise up,
red,
right?
Yeah.
And so I had so many women go, oh my gosh, I didn't realize what happens is estrogen. The higher your estrogen is, you can't break down that chemical histamine, that hormone histamine, like you want to. And so it floats around in the body more and can cause more of those allergic symptoms. It's kind of similar to what they call the period flu. A lot of women get sick or feel run down, or their asthma gets worse, or again, they get congested. They just feel blah. They feel maybe feverish close to their period. And it's a real thing. It's called the period flu. And I had hundreds of responses of women that were like, every month, I feel like the virus gets me, right? Like this is it got me. And then their period starts and it goes away. And I'm like, yes, estrogen, the hormone estrogen, has a receptor on every single immune system cell. So all those immune cells that are fighting bacteria and viruses and all the things, like if your estrogen is up or down or up, it's going to affect the immune cell. And it could put you in a sort of just run down feeling, and you just sort of feel sick and flu-like. And if you look it up online, they call it the period flu. And so many women were like, oh my gosh, I thought I was getting the virus, and it's just my period.
And in terms of the histamine response and the flu response, like I can totally relate to that. Would you say that takes us back to that analogy of reducing the water in your bucket?
Yeah. It's definitely, that's a big piece of it. Because if a lot of the water in your bucket is that histamine. So for people who don't know, histamine is a chemical or a hormone that's released by some of your immune cells. They're generally called mast cells. So if you come in contact with something you're allergic to, or like poison ivy, poison oak, and those cells basically explode, they release a bunch of hormones and a bunch of other things. One of them is called histamine, and histamine causes you to feel drowsy, and it causes you to get stuffy and sniffy and drippy and coughy, like the 7 dwarves of allergies, right? And so what happens? So if you are eating foods though that are increasing your histamine, if you have a lot of GI issues, gut issues, gas, bloating, constipation, diarrhea, if it truly is allergy season, if it's your spring, I'm heading into my fall, So on top of it, you will have blooming trees and blooming flowers and blooming everything. Then your bucket's just going to fill up. Now your period is about to start. And so it just overflows. Your estrogen's in some women, their estrogen is higher than it should be heading into their period. And histamine just can't get broken down. And so the bucket overflows and they feel like crap going into their period.
It's crazy to think like how many things can trigger us to, you know, for our water to just overflow over that bucket. In terms of the histamine response, we already covered that, you know, coffee and chocolate is one of those type of food groups that can increase that histamine response. What other food groups or what other triggers may release more histamine?
Alcohol is a big one, which nobody likes me to say.
No one does, because everyone loves a good glass of wine.
Everyone loves a good glass of wine, especially in the pandemic. Alcohol sales have gone through the roof because, you know, people are like, well, what else do we do? And that's a huge trigger for histamine for a lot of people. Aside from the typical, fermented can be a big trigger. Fermented foods, aged cheeses, deli meat, so like salamis and prepackaged turkey and prepackaged ham and stuff like that. Believe it or not, leftovers. So when you cook food, eat it and then it cools down and you put it back in your refrigerator, that can actually generate a histamine response with the bacteria that are not going to kill you, but they still form on the food. And then you eat it. And if your bucket's close to overflowing, some people do not do well with leftovers and they know it. You'll ask them like, don't you want to take that to go? And they're like, oh, I never eat leftovers. It upsets my stomach or it makes me feel bad. Or, you know, this, and so I'm like, oh, histamine. That's so interesting. And so those are kind of like the big food ones that I see.
I remember that day that you posted that about leftovers and I messaged you and I was just like, what? Leftovers? Like
for some. Yeah.
Yeah. But you also mentioned it wasn't just before your period, also at times throughout your ovulation.
Ovulation. So right before ovulation. So ovulation usually roughly happens in the middle of your cycle. So for the average woman who has a cycle every month, so every 28 to 30 days, ovulation is generally in the middle. So ovulation is the act of releasing the egg. But to get there, to like have the big egg release, your estrogen surges really high, like really high. And it's normal. It's supposed to. It's a signal to the brain, like, all right, do it. Release the egg. But for a lot of women who have a fairly full bucket, that rise in estrogen is, even though it's normal for them, it is too much for them. And so they get histamine feeling, allergics feeling right before ovulation and right before their period. So being able to track your symptoms throughout your cycle is definitely a really great way to see, is this true for you and what symptoms are you having? Now, the other interesting thing to note though, is we are generally born with two ovaries, left and right, generally. But lefty and righty are not twins. They're sisters, not twins, which I fully realize twins are sisters, but you know what I mean? So like we are taught in the textbooks, left ovary ovulates 1 month, and then the next month, right ovary ovulates, and they alternate back and forth. So not the case, not true at all. Some women do go back and forth. Some women are dominant. They will actually feel ovulation on one side of their lower hip bone or the other, their lower hip area. Some women will maybe ovulate out of the right side 3 months in a row, and then they'll go left side, and then they'll go 3 times in a row and right, and then they'll go left side. And what's mind blowing to a lot of women is I'll go, when you get these symptoms, do they happen every month? Do they happen every second month? Do they happen every third month? Or do they happen kind of like you have normal, and then like totally weird, and then normal, and then totally weird. And they're like, oh, I didn't, I'm like, it's like you have Cinderella and then you have like, like the evil queen in your ovaries. One of them's going to cause symptoms and the other one's not, and necessarily. And so, but this is where tracking helps. And if you can feel which side you ovulate on, that helps even more. I'm a very right-sided dominant person. in the lower right side of me, I feel most months, that's when I ovulate. And if I don't feel it, I know I'm in trouble. But I've like figured this out a long time ago. So I've had a lot of months and years to track and practice and keep note. And so for some women hearing for this for the first time, it could be really helpful to go, oh my gosh, I'm going to start tracking my symptoms. Where do I get my allergy symptoms? Where do I get my GI symptoms? Because the cycle, I don't think the menstrual cycle gets as much credit or press as it should as it relates to women. Because whether you want to get pregnant or not, women, that's what our body focuses on. It's what we spin around. And I know a lot of people don't like to hear that if somebody's not trying to get pregnant or not trying to identify with that. I understand that, but that's literally what our brain is setting us up for. Am I safe enough and healthy enough to have a baby? Whether you want to or not, I don't care. But am I safe enough and healthy enough to have a baby right now? And I think if women understood that, instead of like managing or ignoring or suppressing their cycle, if they like understood their cycle and worked with their cycle, I think it'd be swimming with the current as opposed to swimming against the current, and be really a lot more helpful.
That is so important for our listeners to understand, because so many years I was suppressing my cycle, from years of being on the pill and then eventually coming off it, not realizing the danger I put myself in it, and, skipping periods and trying to do my best to just, not get it. And now I embrace it more often now, which is amazing. So I love that you mentioned that. It's really, really important for our listeners to understand that. I had a really good question. Tracking. So with the tracking, you have years of experience. I've been tracking. We both have the Oura ring.
Yes, I normally wear my Oura ring stopped connecting.
Oh no.
I know. So I have a tech request into Oura on what to do.
And I also read your recent article about using the Oura ring to track your cycle, your ovulation, the body temperature, which is awesome. However, I know for some people it's not feasible to get the Oura ring.
Sure. Yeah.
We also want to make our listeners understand that sometimes the apps are not accurate. And
especially
I think that's really important.
The predictive factor. So, I'm sure you come across this as well. I had so many patients through the years where I go, do you ovulate? And they'll go, yes, on day 14. And I'm like, how do you know? And they're like, because the app on my phone says so. Like, no, the apps of like, you just enter and you're like, yes, my period started today. And then it will calculate forward when you're due. And because it's an app, it's just putting your period basically dead center, because that's what the apps are programmed to do. It doesn't mean you're going to ovulate there. So I actually have had a number of fertility patients not get pregnant because they thought they ovulated per their app, right dead center. They're like, the app said I ovulated on day 14. And I was like, how would the app know? The app has no idea about the function of your body. And until they started testing for ovulation, and one of my former colleagues, she ovulated on day 18. So I was like, let's shift where the sperm meets the egg. And sure enough, she got pregnant. She was missing the window by 4 days, which is a big deal.
Yeah, that's a huge deal.
Yeah. So you're right. Tracking is wonderful, but you have to make sure you understand the limitations of the app and what you need it for. If you're just trying to figure out when your next period is, great. Like a lot of them are decent they're smart. They work to you over time.
But in terms of someone, wanting to, I guess, estimate the ovulation, maybe wanting to get pregnant, I usually recommend clients to use a body thermometer because it measures the temperature. What are some ways that you suggest your clients?
I actually have my clients do ovulation predictor kits that they pee on, or LH strips. They're the same thing. So it looks like a pregnancy test, but it's actually a test for ovulation. So the reason temperature is really important. But when you release the egg, you start to make a lot of hormone known as progesterone. Progesterone is warming to the body. And because it's warming, your core temperature will go up usually a degree or so. So when you're checking your temperature, you will notice at some point, like, poop, you pop up a degree and then you stay up in that degree if you continue to check. Once your temperature pops up, you've already ovulated. It's after the fact. So if you're actively trying to get pregnant, I need the sperm in there before the temperature pops up, not after. So I will tell women, tracking your temperature is very helpful for to get month to month, to see if you actually to see the health of your progesterone in a sense. But if you're trying to get pregnant, you need the sperm in there, then I would suggest pay attention to your mucus. Do you get the stretchy fertile mucus change? That stretchy mucus, it's stretchy because there are these little tubes in there, kind of like raceways. And when sperm is in there, the tubes take the sperm and direct them straight up towards the egg. So it does serve a purpose if you're trying to get pregnant. Otherwise, the ovulation predictor kit, when it's positive, you're likely going to ovulate in the next 24 to 36 hours.
So fascinating to know, like, so much. Like, I know this stuff, but I'm sure our listeners are like, oh my God, like, vaginal mucus, like what? And all this.
Yeah.
Like, I don't need to track it with my app. Like, what's going on right now?
Yeah. Yeah. And at least it just helps for somebody who's like new to listening or new to their body or new to figuring this out. Like I can be very overwhelming, as you know, but it's also very exciting. It's like, you don't have to do everything. You don't have to track everything. Just start with one sign and track that for a couple months, and then add in other signs, or then pay attention to a few other symptoms. And by sign, I mean like the mucus, or do you get twinges, or, when does your period come, or breast tenderness, maybe a sign of impending period. But then like symptoms could be, do you get allergic symptoms? Do you get PMS? Are you having cramps? Are you getting diarrhea? Can you not sleep? And so tracking that, you may find it's very cyclical related.
So good. While we're on the topic of tracking, let's talk a little bit about the Dutch test. I know, you're one of the medical directors for it. I don't think any of our listeners have an understanding of it. So would you mind explaining to them, what it is?
Yeah, absolutely. So, and it's available in Australia. And New Zealand, as a matter of fact, as you know. So it's the Dutch test, but we do not test for Dutch heritage. It's an acronym. So it stands for Dried Urine Test for Comprehensive Hormones. So it's an at-home test. You basically pee on pieces of filter paper 4, maybe 5 times throughout the day at a specific time in your cycle. If you have a cycle, if you're menopausal, then you can do it anytime. And then you let them dry and mail them back to the lab. And because it's a urine test, we get all your hormones. We get things like, so we get estrogen, we get progesterone, testosterone, we get a hormone like cortisol, your stress hormone. But we also get what are called metabolites. So metabolite is just a fancy word for a hormone that's been broken down. So it's been broken down through your liver, and it's now getting like flushed out of the system. And the reason I want to know what these metabolites are, because I want to know, how do your hormones get broken down? Because some of these pathways are bad. Some of these metabolites cause damage. Your DNA does not like them. Some of these metabolites cause things like hair loss and acne and anger, so if you come to me and say, I have a massive abundance of chin hair and I'm losing the hair on my head and I have acne all along my jawline, then you better believe I'm going to look at this pathway. I'm going to test a Dutch test and say, let's see if this pathway is overactive, because we can use diet, lifestyle, supplements, medications if needed to help direct you away from this pathway in that example. And so that's why I like urine, because you get more information as it comes out the other end.
On that topic of chin acne and hair growth, that usually predicts more to like the PCOS symptoms. Yeah. So would that, again, like by someone showing those symptoms, would you still get them to do a Dutch test, or would that be enough information for you to help the client?
So you can have acne and the chin hair and what have you. You can have it from elevated testosterone, or elevated DHEA, which are what we call our androgen hormones. But in some women with PCOS, those hormones are completely normal. But what's happening is those hormones have turned and they're getting broken down through a pathway that we call the 5-alpha pathway. And that 5-alpha pathway is the cause. It's the reason that you're getting these symptoms. And so some people think, oh, I just need to lower my testosterone, when in fact you don't. Your testosterone's fine. Let's not lower it. Let's keep it for libido and keep it for muscle mass. But let's affect this pathway. And so that's why I like looking at the Dutch test with PCOS. The other reason I like looking at the Dutch test is PCOS, those same hormones, testosterone, DHA, what have you, they're made in the ovaries, but they're also made in the adrenal glands. So sometimes some people are so stressed out, their adrenal glands are very active, pumping out lots of hormone. And so it's contributing, the testosterone and DHEA is contributing to a PCOS-like picture. So it's nice to have kind of an idea of what are your ovaries doing with estrogen and progesterone, and then what are your adrenals doing with cortisol and DHEAS. And then we can put the bigger picture together, like know where we're going and what we're doing.
I love that. I remember that's awesome. It reminds me when I did my Dutch test, I think it was probably about 2 or 3 years ago. And I was living a very stressful life back then. And when I had my specialist check the test, he came back with saying that my androgens and my DHEA were so high that we had to change. Well, we did make lifestyle changes. And I think it also comes down to our listeners understanding that it's not always just about the hormones, but it's also our environment, whether it's external or internal. Like you mentioned, like stress has a massive effect on it.
Huge. I think a lot of people don't realize how much stress has an impact negatively over time on the body. Now, as humans, we're very resilient. Think right now, we're in a pandemic and hopefully coming out the other side, but think about hopefully think about in like 20 years or 30 years. And, our kids or grandkids are like, oh, wow, how did you survive? Like, how did you manage that? And as us have gone through it, we'll be like, we didn't have a choice. Like, like a lot of people, depending what their trauma is, that's the response. Like, I didn't have a choice. I had to get through it, And so, but it takes a toll on the body. It takes a toll, and it may not take a toll that you think. Like, it can affect your heart system. So it might affect your blood pressure, and it can affect your metabolic system. So like it might affect your glucose. You might have high glucose and develop diabetes. It can affect your brain. It can put you at risk for dementia and Alzheimer's. It can totally affect your hormones. So it'll affect your cycle, and it can affect your ability to become pregnant. It affects your skin. All that stress is aging, and it affects our bones. It causes us to have over time a higher risk for osteoporosis. And so in the moment, all we're thinking is survival, which is normal, but it's how we close the gap, right? Like how we take care of ourselves, how we handle it afterwards, what we do with ourselves, that really helps to determine our long-term. And there's a difference between having trauma once and like maybe you've led a pristine life with no issues, and then 2020 happened and that's the only major event in your whole life, and then you move forward. But a lot of people can't say that. A lot of people have had stress after stress after stress after stress. Like it's, even though a stressor goes away, like then it's just the next thing right behind it, with no breaks, no rest. And for a lot of people, it started at childhood, and that it's contributing to a lot of really unfortunate health outcomes in our societies, which is just not fair.
Yeah, I can totally relate to that. It literally, like stress literally affects everything. And like you said, whether it was just 2020 affecting you, or it was, years beyond that, whether it was like childhood, teenage years. And, as you said, like we're very resilient, but there comes a point in life where if we're not dealing with the stress as it is, and just trying to avoid it, eventually it's just going to hit us, well, pretty much slap you in the face.
Yeah,
like,
it does.
It's happened to me, so I can definitely be like, oh my God. And it's everywhere. So it's something that we obviously can't avoid, but we need to manage it. And like, I know you're a big advocate about finding ways of managing these things. What are some things that have helped you, or, helped your clients to recognize, stressful events or things that were able to reduce the stress the best they can?
So I'm all about practical and tactical, because I know that everybody has a different budget. Just like you said earlier, like you and I have Oura rings. That's not somebody's priority in their budget for everybody. And the same goes for how we handle with stress, or how we offload or release steam or what have you. But I will say that when it comes to stress, when you're stressed, you have two systems in your body. So you have sympathetic, which is fight or flight, which is what most of us are in right now. And then you have your other system, which is your parasympathetic, which is your rest, digest, heal, and repair. So we want to be in our rest, digest, heal, and repair often. You're human. We're going to go back and forth, but we want to be there often. So three actually big things that help keep us over there. One is play. When you're playing, when you're genuinely enjoying yourself, when you're laughing, true play, however that looks for you, helps keep us over in the rest, digest, repair, heal. Community you feel safe with, that you feel protected by, that you feel has your back, that you truly enjoy. People that you truly enjoy, not people that you're like, fine, like we can hang out. Like that's not going to do it. But the people you truly enjoy, that will help keep you in rest, digest, repair, and heal. And then the third thing really is, like I said, like joy. So when it comes to, if you think of like an energetic scale, and at the bottom are things like anger and jealousy, and you like the top of the scale is love. I've heard a quote. It says healing happens at joy. And I think in my head, I think it's because when you're truly joyful, not happy, but joyful, you're emanating joy. You're probably with community of either a community of one or a community of a large one that you truly enjoy and love. And you're probably enjoying yourself, and you're probably feeling relaxed and safe and protected. And then that helps keep you over in that rest, digest, repair, and heal thing. And so, and a lot of that doesn't cost a lot of money, to hang out with your best friend that you truly enjoy, even if it's over Zoom for 10 minutes, like can really just fill up that part of your bank. Like to laugh at the hilarious memes. I am so proud of the world right now with all the funny memes that are going around.
So good.
Right? Like the funny TikToks or Instagrams or like whatever it is. If you're mindlessly scrolling, but laughing and enjoying yourself for 10 minutes, like that's going to pull you out of the fight or flight and put you into the rest, digest, heal. And now I'm not giving you permission to do that for hours on end, but it's these little things that don't cost a lot of money that can help initially. Now, beyond that, is a base. Obviously, humans, our brain has one primary mode, which is to keep us protected. It's not to make us happy. It's to keep us protected. And so if you don't feel protected, and maybe we've talked trauma, and I don't want to trigger anyone, but like finding ways that you can work through that, however that looks, whether it's in counseling, whether it's with some sort of therapy. There are a lot of therapies out there right now, whether it's some sort of self-help course or book or step or something that you can do, I think is hugely important, because as humans, we are a pack species. We can't do it alone. A lot of people try to do it alone, but we are truly a pack species. And so, how you can get that support is great. And then on top of that, we're looking at things like, do you even get enough sleep? Like, are you hydrated? Do you remember to eat in the day, or are you skipping meals and screwing up your blood sugar? Are you not the best at keeping your boundaries? Do you let people take advantage of you? Do you say yes to things you really want to say no to? Do you put everybody else first and yourself last? And so it's these little things that add up over time that just pick one. I'm like, just pick one. If sleep is really important to you, then set your set an alarm, a reminder on your phone to go to bed an hour earlier, to get off Netflix and watch the funny videos for just 10 minutes and, and then go to bed. And so, or if it's, about hydration, then like really how much water you need, do you need to add electrolytes into your water? If you realize like, gosh, you know what, I don't eat breakfast and I don't often eat lunch till like 3 p.m. and I pick at dinner, or I, maybe I binge at dinner, like reevaluating that. What does that look like for you? Because that's just going to send your glucose into a tizzy. And when your glucose is in a tizzy, everything gets in a tizzy, including your stress response. And so these are, again, like nothing necessarily has to be below the budget, super expensive, but it's picking something in this list of how we can manage stress that works for you. Because what works for me is not going to work for you. I like to meditate and I like to journal. I know a lot of people that absolutely do not, right? Like they're like, journal, ew. I'm like, all right, cool. Fine. What works for you? Like, does exercise work for you? Was talk therapy work for you? There's definitely, does taking a bath at night work for you? That's one of my best friends. What works for her is to decompress. Is she and her husband watch shows? They watch Netflix. So they'll watch like 1 or 2 episodes at night. And she's like, it's my decompression time. She's like, don't call me. I'm watching my show. And she can just zone out, not have to think, not have to make decisions, not have to do anything. And she's like, it's wonderful. I lay on the couch, I drink tea, I watch my show. And then that's my me time. Whatever works. I don't really care. Just don't make it destructive. It's when we get into alcohol, it's when we get into binge behaviors. It's when we get into things that, are not serving us, that we think are helping our stress. That's when that's actually going to end up being more stressful.
Yeah. It's being very mindful, being mindful of the choices that we're making.
Yeah.
And
exactly.
one important, thing that you mentioned is also, not pleasing everyone else. Like I used to be such a people pleaser, be like, yes, I'll help you and I'll do this and I'll do that. And I burnt out so quickly. So protecting your energy and protecting what you need is so important.
Yeah. I had a patient who dogs were her life, are her life. Dogs are her life. We're still in contact. And she was an extreme people pleaser, no boundaries. And I said, I'm like, okay, cool. You're going to put the dogs first, but like, you have to be in the top 3 of your family. So if the dogs are first, I need you to put yourself second or third in the family on a routine, not last, not dead last after everybody else, because that's why you're in my office feeling like crap, because you give all day. You have nothing left for yourself and you're looking for me to take care of you. But I need you to help me help you put yourself in the top 3. And it's amazing the number of women who were like, oh, like we're such innately, not always, but often we're givers. We're taught to be nice. We're taught, to say, well, just do it. Just do it this once. Like, I don't want to hurt their feelings. I'm just going to do it. And I was reading another, Melissa Urban, she owns the Whole30. I was reading her blog, her newsletter actually. And she says, my executive assistant doesn't maintain my schedule. I do. And I don't have an executive assistant. I have an executive assistant for my team who helps my whole team, but she doesn't manage my schedule. And all the time people are like, you need to delegate that. I'm like, nope. Because I know where I need to put the blocks in. I know where I can go. Actually, I'm going to want a longer lunch because that's going to be exhausting. That's going to take a lot out of me. That's going to require a lot of prep. I'm going to need 15 minutes here, 30 minutes there. And she was saying the same thing in her newsletter. And I was like, yes, a CEO of a major, very cool in our industry, US company manages her own schedule because she's protective of her time and her boundaries. And I was like, I feel vindicated. I do the same thing. And I think in our society, a lot of women are overscheduled, right? They're constantly on the go because everybody in their family is on the go and they just say yes to everything and they forget to schedule in downtime, and we all need downtime.
I think that's so important. As women, like you mentioned, we're just like go. But important thing that you just said is scheduling that downtime, whether again, it's just a walk around the block, or sitting down watching TV for half an hour, or meditating, taking a bath. Like there's so many ways to just be able to recognize what you need to eliminate or even reduce a little bit of the stress as best as you can.
Yeah. Yeah. And you're right. It doesn't have to be crazy downtime. It could just be like 15 minutes in between calls. So you can go to the bathroom. How novel is that? Right? Like you can drink some water. I have a really good, one of my best doctor friends. She's extremely busy. She sees 30, 40 patients a day. And her doctor was like, you don't eat and you don't go to the bathroom and you don't hydrate. Like it's affecting your health. And so you need to schedule yourself a lunch and schedule yourself 15-minute breaks here and there to drink water, go to the bathroom and eat some food. And I'm like, hello. Like the body can't sustain on air and stress and cortisol all day long. So, but we tend to do that. We overpack our schedule and all of a sudden we're exhausted.
It's so funny that you mentioned that, because I literally had a client this morning and she was saying how her water consumption has been reduced due to her work. And I was like, all right, let's set reminders. Come on,
Yes.
let's get on top of that. So it's so funny how there's such easy, simple ways for us to, pick a habit, but we tend to either forget or neglect it.
Yeah, it's true. And I think with a lot of the work from home, everything on video, we think because we're at home, we need to overschedule to overcompensate. I read a hilarious study that was like the number of people who are in meetings, conferences, whatever, with the camera off, who go to the bathroom because they're so scheduled back to back that they never make time to go to the bathroom. Whereas at a work office or school, you have built-in breaks where you can be like, I'm going to pop out to the toilet real quick. I'll be right back. But at home, it's like one meeting ends and immediately your Zoom or Teams or Slack or something is ringing and you're like, crap, I have to go to the bathroom. And so this study was a very high percentage of people who just took their computer with them because they don't schedule breaks anymore.
It's crazy. Absolutely crazy. Well, for our listeners, I hope that you have a better understanding right now that you don't have to invest hundreds of dollars into, reducing your stress. It's literally like the simple things that are going to give you joy, as Carrie mentioned, and just working on better choices for your long-term health and be able to just, try and let go of the rest as best as you can.
Yeah. It's the mountains out of what we say in the US, the mountains out of molehills. When you're making mountains out of molehills, the body doesn't know the difference between imagined stress, worst case scenario stress you're making up in your head, and actual stress. It responds the exact same. All it feels is a threat. And so if you're listening and you're like, oh, that's me, I worst case scenario everything, even if it doesn't happen, keep that in mind. Your body is reacting as if it actually is happening. It doesn't know the difference. It's just trying to protect you.
So powerful once you're able to be more self-aware of the thoughts that you have in your head. But that's a topic for another day. Seriously, we could literally talk about that. I know, right? I know. I reckon let's stop it there, because otherwise we'll be here for like another hour just talking about everything.
Sure.
Carrie, thank you so much again for jumping on today. I know our listeners are going to be taking a lot of value from what we've been talking about. Before we leave, where can our listeners find you?
2 places. I hang out Instagram. I am at dr.carriejones and also at dutchtest.com. Everything on dutchtest.com is free. All the webinars, all the education, all the podcasts like this one are up there. So if you want to learn about the test, but just about hormones, then check it out.
Amazing. Well, girls, if you haven't followed Carrie yet, please do. She is phenomenal. And as I mentioned before, her page is filled with loads of free educational information and plus funny reels and memes. And you know what? That's what we're here. We're here for the fun stuff. You know what?
Yes.
If you're stressed out, just go to Carrie's page. You'll feel much joyful.
I love it. Thank you. Thank you so much.
Thank you for jumping on. Girls, if you enjoyed today's podcast, please screenshot and tag us at the Women's Fitness Academy. You can tag myself and also Carrie on Instagram. Until next time, I hope you all have a wonderful day. Take care of your stress and find a lot of joy in what you love doing. Until next time, girls, thank you. Bye.